Nursing care of transgender individuals. How nurses' attitudes and belief systems affect the care transgender individuals receive, by Lorraine Chenard. Transgender individuals have existed throughout history, and people who were gender fluid in many cultures were thought to possess wisdom that traditionally gendered people did not. Ancient Rome had the Great Mother, who was considered an intersex deity for whom gender had not yet split. As ancient societies transformed from matrilineal and communal societies to patriarchal societies driven by property ownership, the oppression of women began. Many people believed that people who bridged genders were possessed of a special knowledge or greater insight into life, so they felt threatened by them. This is where the origin of shunning transgender people began, and it has been a long climb back to acceptance for our transgender folks. The first American to publicly announce that they underwent gender reassignment surgery was World War II veteran Christine, formerly George, Jorgensen in 1952. She went on to write a book about her transformation that later became a movie. She used her fame to educate people about transgender individuals, though these individuals would remain stigmatized for decades to come. While transgender individuals are more widely accepted in today's society, they still lag behind gay, lesbian, and bisexuals as far as social acceptance is concerned. Many people feel threatened by transgender folks as cultural identity has been tied to gender for much of recent history. As the sociology of diversity gains ground in the U.S., our social practices must also grow. Members of the transgender community continue to experience disparities in society, most notably in healthcare. There are many more studies being done exploring treatment for transgender people who seek it, and many healthcare organizations are actively exploring ways to combat discrimination. Many universities are offering health insurance plans that include coverage for hormone therapy or gender reassignment surgery for their students. The APA and the ANA have increased their advocacy as well. Now, being transgender is more widely recognized as part of the human condition. This acceptance needs to be brought into day-to-day nursing care. A study done at the University of California found that the rejection transgender people encounter is worse than gay, lesbian, or bisexuals. The negative attitudes experienced by transgender people were harsher and much more pronounced. Many gender nonconforming folks report job loss, bullying, and physical or sexual assault. The rate of attempted suicide for transgender people is much higher than for gay, lesbians, or bisexuals. Recently, on the reality show Survivor, one of the contestants, Zeke, was outed by another contestant as being transgender, and he said that he had never told anyone on the show because he wanted to be just Zeke, not the transgender Survivor contestant. He also said that once people find out I am transgender, sometimes that's all that they will see. As reported in a study published in the American Journal of Public Health, half of the transgender women and a third of the transgender men surveyed said that they struggle with depression from the stigma, shame, and isolation caused by how others treat them. Nurses' lack of knowledge regarding transgender patients' health issues cause harm, both emotional and physical. It is important for nurses to know that transgender people require competent, patient-centered medical care, just like any other patient. Cultural sensitivity is just as important for transgender people as it is for other cultures. Transgender people face multiple obstacles to quality health care, including outright discrimination and refusal of treatment. It is especially difficult for them to seek sexual and reproductive help for fear of judgment. While attitudes are changing, there is still a long way to go, and nurses need to ensure that they are providing good, culturally competent care to their transgender patients. Nurses' lack of knowledge regarding transgender individuals have caused harm, both emotional and physical, to their patients. Per a study in Advances in Nursing Science journal done to discover how nurses felt about and dealt with transgender patients, The overall picture was one of great discomfort in talking about or working with these patients. Many of the nurses' discomfort stemmed from frustration or confusion over which pronouns, which bathrooms, and which patient rooms should be assigned to a transgender patient. Many transgender patients report that when they go to the emergency room, often their problem is the last thing that is addressed once their transgender status has been identified. If a person is there for an injury, it should not matter what gender they were or are now. Medical professionals focus on the medical problem at hand, not the patient's plumbing. Nurses need to acknowledge their bias. Every person has bias. It is the lack of acknowledging them that can cause harm, not the act of having them. In a study titled Nurses' Knowledge About Transgender Patient Care, it was found that nurses tended to gossip and discuss their transgender patients out of earshot of the patient. Some nurses even defended this behavior because the patients couldn't hear them. Many nurses were found to use dehumanizing language, such as the term tranny, or refer to their patient as it. The study found that once nurses acknowledged a bias and were educated regarding transgender patients, their nursing care improved. What transgender people would like their nurses to know is that they are patients like any other patient, that their identity as transgender is only part of who they are, not all of who they are, and that it is not a mental illness. While many transgender folks struggle with mental illness, that is usually a function of how society has treated them, not the cause of their being transgender. Part of a nurse's role is to be a patient advocate. I challenge all nurses to educate themselves on transgender individuals and become culturally competent in transgender nursing care so that you can advocate for these patients in the future. Our profession has failed the transgender community to date in our lack of education and understanding. The Joint Commission is urging U.S. hospitals to create a more welcoming, safe, and inclusive environment to improve care for LGBT patients. And this is happening with our lesbian, gay, and bisexual patients, but transgender patients still report a lack of culturally competent health care. This culturally competent care must begin with nurses educating themselves and becoming advocates for their transgender patients. Consider this a call to arms for nurses to advocate in all their workplace environments. Hospital nurses, get with your education committees, suggest surveys be conducted to determine existing knowledge, conduct training classes, and then follow-up surveys to determine changes in knowledge and attitude, and then conduct further training if needed. Educators, incorporate curriculum in transgender education into your nursing programs. Be sure your students understand and care for transgender individuals in culturally competent ways. Nurses on state boards of nursing, develop and encourage CEUs in transgender patient care. In multiple studies, education intervention has been shown to improve attitudes of nurses and strengthen knowledge regarding transgender patient care. It's up to us to ensure culturally competent patient care for some of our most vulnerable patients. Here are my list of references for you to do further research on your own. Good luck and thank you for listening.